watching KTN Prime, and we thank you for staying with us. We're having a conversation about cancer and the fight that this country is heading towards in terms of fighting cancer. What progress have we made? Basically a stock taking. Remember, the First Lady, that is Margaret Kenyatta, is hosting First Ladies from the region to just stock take. See, look at the progress that the region has made in the fight against cancer. In studio, I have Jarim Omogi from Kenya Cancer Association, and he's helping us to understand the journey that cancer patients go through, and of course that announcement that was made today by Health Cabinet Secretary James Macharia. Jarim, thank you for staying with me. Just after we had a conversation, you're telling me there are three major areas that NHIF must cover if it has to make a difference in the lives of cancer patients. That is surgery, chemotherapy, and radiotherapy.
Yes. These are very important process as far as treatment is concerned, and it more again depend on the stage that you are in. If it's a stage that someone has to go for surgery, it's quite expensive, and we won't like NHIF to come in and tell us they'll cover the bed cost. Would like let it cover as far as the surgery is concerned. Can it cover that? And after surgery, there is post-surgery where we have got very strong medication that these patients again need, and it would be important again if the government and the stakeholders can tell us what are some of the NHIF. Will it also go up to post-surgery? There are some of the pertinent questions that indeed the government need to answer and give hope to Kenyans, because this is about giving hope to Kenyans.
All right, this is going to take place, probably be implemented probably in the next 1 month, but if you were to have the ear of the Cabinet Secretary, Ministry of Health, what would you tell him about implementing this?
I would tell the Cabinet Secretary, Bwana Cabinet Secretary, cancer does not wait for us. Cancer is killing 78 Kenyans per day. A whole bus crashing every day. So basically you want this implemented now? If it's possible, let it be now. 1 month later, we lose lives as we are continuing with him every day.
If you were to give an assessment of the fight against cancer in the country, what progress would you say the country has made?
We appreciate what the government is doing as far as coming up with the machines to the county is concerned. However, they are for screening, not for treatment. We also appreciate a number of bills that are currently being forwarded, and of course...
Okay, wait. So when you say the machines that were given to the counties are for screening, not for treatment.
Yes.
So once someone is screened at the county level,
yes,
do they still have to make their way to Kenyatta National Hospital? In other words, is that what you're trying to say?
When someone is screened at the county level, it will depend if diagnosed and found really that the person has got the disease, then we will have to go now to be looked at which stage. There are some stages that we cannot be dealt with at the county level. They'll have to travel to Nairobi to Kenyatta National Hospital.
Which stages are this?
What we know is that...
Because hope, when these machines were given,
yes,
is that this would now be able to cater for terminal illnesses, including cancer. So what stages are we looking at?
What we know, that in this country, research has shown that 90% of patients that go to health centers for as far as cancer is concerned, mostly they are found at stage 3 or stage 4. At that stage, they'll have to travel to Kenyatta National Hospital for more treatment on that. That what we are saying is, yes, they'll be found at the county level, yes. However, even the machines themselves, we also need personnel that currently we are lacking within the county level. So, yes, they have done well. They have come also with the National Cancer Institute, that's the board, and we appreciate all this. However, most of these things, even the cancer bill, as far as prevention and treatment, screening, prevention and treatment of prostate, cervical and breast cancer is concerned, most of these things are in paper. Let's execute this so that we can save the 78 dying every day.
And you've made it clear that 1 month is too long a time to wait.
Of course.
Okay, so we're doing this for the benefit of our viewers. Someone is seated at home, your relative, your friend, your neighbor has just been diagnosed with cancer. Where do you start?
In most cases,
in terms of treatment, in terms of management?
Yes. In most cases, when someone is diagnosed cancer, what we know with the myth currently going around, too many they think is a death stage. However, cancer is treatable.
First of all, just before we get to where do they start from, now that you've mentioned myths,
yes,
what are some of the myths that you've had out here that we need to clear now?
One, cancer is not treatable. That is not true. Cancer is treatable. We have survivors that have survived for the last 24 years of cancer. It's treatable. 2, is not a death sentence. 3, cancer is not a punishment from God. Cancer needs treatment. We appreciate prayers, but we must go for treatment. And the most important thing, let's come out of this issue that I better live without knowing than knowing then I die. Let's go for early screening, because when found early, it's treatable and you can live a cancer-free life forever.
How many times would you advocate for someone to go for screening for cancer?
It depends with the age, and it depends with which cancer. For example, breast self-examination. Breast cancer, for example, we have got 3 main. That is breast self-examination, we have clinical breast examination, and then you have mammography. Even breast self-examination currently is being said at least when you began the menstrual cycle, that is, then you need to be doing breast self-examination. However, you need
yearly?
to be trained on it.
Is it yearly?
At least monthly. Okay? Breast self-examination, at least monthly. For CB, at least yearly. However, when you are 40 years and above, and then yet again we reduce it. Okay? We reduce the number of years. That is 1. 2, for cervical cancer. Currently, the public masking that we are doing, most of it, we are doing via villi. Okay? However, we also have the cryotherapy machine that we can use for that.
Okay.
And the research has shown that indeed, if for example, breast cancer and prostate cancer, if it's within your family, then meaning you're at higher risk, of getting cancer. However, it's need to be noted that everyone is at risk of getting cancer.
Great. So we're running out of time, but the question that I asked you before that I didn't give you time to answer.
Yes.
So someone has just been diagnosed with cancer. Yes. Where do they start from?
When someone is diagnosed of cancer, the doctor will advise the patient. First of all, they will be known the stage on what next. For example, if it will be just radiotherapy, then chemo is the stage. If it will a higher stage like 4th stage, then for example for breast cancer, then you have to go through mastectomy, then you go through radio, and then you go through chemo. But these are processes, but it depends again now with the stage.
Okay.
Yes.
Jarim Omogi, I'm sure this is a conversation we'll be having more of in the next coming days, just to help Kenyans understand what cancer is all about and how to manage it. Of course, this is one of the most expensive diseases. Jarim Omogi from Kenya Cancer Association says, 1, cancer is treatable. It is not a death sentence. It is not a punishment from God, and you need to stop this notion of I'd rather not know whether or not I have cancer. You're watching KTN News. We thank you for staying with us. We're taking a short break, and when we get back, I believe Joy Dorin Bira will have the day's business news.